looking down at our cell phone it's going to cause, we're going to have a rash of neurological diseases stemming from that. You have very sensitive neurological structures in the neck that go up into your brain. And when everyone is, down like this, I am seeing a younger and younger cohort of patients, teenagers, and they're coming in and their necks are wrecked and they all have headaches, they have numbness, they have tingling. And when I x-ray their neck, it looks like I'm x-raying a 55-year-old. And it's really not good. So if I could tell everyone that's listening two very important things, okay? Look down with your eyes.
Welcome to The Ownership Game with Gary Montalvo. What would it take to get into the driver's seat of your life and leave your mark? The Ownership Game starts now.
In today's episode, we're going to get into an area that I think many of us struggle to get an ownership of, our health. From the sedentary lifestyle that most of us are boxed into today, to a healthcare system that values profits over the patient, taking care of ourselves is getting increasingly more and more difficult and even hostile. And let's not even get into the incredible amount of misinformation out there that all just seems to contradict itself. So, to help us navigate these choppy waters, I thought I would speak to one of the members of my care team, Dr. Adam Friedman. Dr. Adam is a Board Certified licensed chiropractic physician. He's one of the owners of Care Wellness Center, located in Margate, Florida. Care Wellness is this multidiscipline, holistic wellness facility. It includes everything from chiropractic care to acupuncture to physical therapy to vitamin injection therapy and a bunch of other stuff. It's basically a one-stop shop for your chronic wellness needs. In this conversation, we got into some of the challenges that we're facing today in navigating our health and wellness, and more specifically, what are some of the things that you can do to live a longer, healthier, and a more vigorous life. So the name of the podcast is The Ownership Game, and my vision for this podcast is that I give people inspiration, tools, knowledge to get an ownership of all aspects of their life. Whatever that looks like, but that they feel like they have some sense of responsibility and power, that they can do something about whatever's not working in their life. And I wanted to talk to you because health and wellness is one of those areas that I think people struggle with in feeling like in ownership. And I think there's three buckets, and you tell me if there's more buckets for you, but I feel like there's a bucket of like the hardcore people, right? The ones that are deep down the rabbit hole. They are eating all the stuff, supplements, doing all the things, working out, probably your camp, right?
Maybe.
And then there's like a camp that's like, all right, they're not gonna do, like, no matter what you do, they're just not gonna do it. Like they
Sure.
just don't care for whatever reason. And I think there's a big group in the middle. I'm gonna put myself in that group who want to do the right things.
Yeah.
But it's confusing. It's overwhelming. There's so much information out there, misinformation out there. And it just occurs daunting. And I wanted to bring you along because, we've been working together for about 3 years now. I see you every week.
Crazy.
And you've been an amazing resource in my life to manage my health, manage my wellness. And I would love to just share and get into this topic so that we can give the listeners some power around this, because I do think that it's like,
Sure.
You know what I mean?
Sure.
So where should we start? I think let's start, give us a little bit of your background. Tell us a little bit of what you do so the listeners get to know you and why they should pay attention to you and all that good stuff.
Sure. Well, again, thanks for having me. I really appreciate the opportunity. I'm super passionate about, the area of health and wellness. And, I'm a 18-year practicing chiropractor. I got my undergraduate degree in psychology and sociology at Indiana University. I went on to get my doctorate degree in chiropractic at Palmer College of Chiropractic in beautiful Davenport, Iowa. I spent the first 13 years of practice in Cleveland, Ohio, and I moved down to South Florida about 6 years ago, seeking a change and sunnier, warmer weather. So, that's me in a nutshell.
For the listeners right now, it's like 19 degrees in Iowa right now.
Oh gosh, it is like negative temperatures in Ohio right now, so it's awful. So there's no sunlight, and I just I had an epiphany, and packed up my stuff and packed a U-Haul and drove down here. So here I am, and couldn't be happier. Bought a practice about 2.5 years ago. It's called Care Wellness Center. It's in Margate, Florida, as you know, and we're a multidisciplined, alternative, holistic healthcare facility. We see a wide variety of people and a wide variety of conditions, and we have a lot of success treating people. So I'm super passionate about what I do, and I am, I'm an educator first. And that's what any good chiropractor will do. Make sure that the patient is empowered and knows that, this is one small step in the journey of getting you back to optimal health. So chiropractic care is, a small piece of that puzzle. I think it's a very important, integral part of that puzzle. I think you've really seen the value of it, and your body has responded to that. And, I'm happy to be able to help people without the use of drugs and surgery. So,
something that's interesting about your practice, and I've never, I've been to a lot of chiropractors over the years, a lot.
Sure.
And your practice is different because there is a holistic component. You have, physical therapy. You do pressure point. You do the supplement shots. You have other doctors. You have a retired, not retired, a former surgeon now. Practice Eastern medicine.
Yeah.
So I guess talk about your philosophy in why building the team and building the practice, because what I can see is that it doesn't fit the traditional model of Western medicine that I kind of can look at to the layman's eye. And I think it'd be interesting to dive into your philosophy in that.
We're going down the rabbit hole now, which I love. So, we treat people with chronic illness. Our healthcare system has evolved over time, and specifically with the pharmaceutical industry. So, early on, pharmaceuticals were very effective at treating acute disease, acute infections, and they were very effective at that. Specifically with people that were 6 years and younger. And over time, through environmental toxins that we're now exposed to in modern society and all the stresses that we're under, these chronic illnesses have developed over time. And, we're still kind of under the assumption that a pill is going to fix all of this. And unfortunately, that really doesn't work these days. Chronic illness is due to multiple different factors. And what a pill does really is it just identifies and treats the symptom of that particular chronic illness. And it doesn't do anything to actually get to the root cause of it. And I wanted to develop a facility that was able to, have a program for people that can really get to the root cause of the problem, so people can live with vigor, we have longer life expectancies now due to modern medicine. However, that longer lifespan is really, affected by chronic illness. And we're treating these chronic illnesses a lot more as we age, and we're not living to our fullest potential. We're not living with vigor. And in our facility, we're empowering people to, give them the opportunity to live with more vigor, with more life, basically. And I don't think that our current healthcare system really does that to people, because it's more like a pill for an ill type of thing. So that's what we're trying to do in our facility. I hope that makes sense.
It makes sense to me. Because I think anybody listening has had experiences with the healthcare system the way that it's designed right now, not really taking care of them. I mean, I find that if you have anything that doesn't fit into a nice little box that they can just immediately call it something and immediately give you a pill for it,
Sure.
They don't know what to do with you. You will be bounced around, tested, probe, is this, and nobody really knows what's going on.
Yeah.
So I personally find myself frustrated by all of that.
Sure. We encounter a lot of people that are frustrated, and unfortunately, with chronic illness, people are still, seeking out, medical physicians for these problems. And I have all the respect in the world for these people, but I truly believe that medical doctors are good for acute illness. And, if you have a broken bone, or God forbid, you're bleeding from your head, your life needs to be saved. And medical providers in an emergency setting, are equipped and trained to do that. And that's the only time I ever want to see myself in a hospital, is if, God forbid, I have an illness or a medical emergency where modern medicine can be used to save my life. But those same medicines in no way, shape, or form treat chronic illness effectively. Because if you're on one pill for something, there's going to be a symptom to that pill. There's going to be a side effect to that pill. Excuse me, not symptom. There's going to be a side effect to that pill. So they're going to put you on another pill to treat that side effect. And then you're going to get another side effect from that second pill, and they're going to put you on more and more pills. So it's just a vicious cycle. So getting to the root cause of these problems through, environmental factors, lifestyle, and a variety of other things is truly what people are seeking out now. And that's what we can provide with our team of chiropractors, acupuncturists, physical therapists, and yes, a 20-year practicing surgical oncologist that got sick of taking out tumors and was like, you know what, I want to practice Eastern medicine. I actually want to get people well. So, yeah.
Who's also my acupuncturist.
Yeah. Awesome. She's fantastic. We're really lucky to have her. So,
okay. There's so many different ways we can go in this conversation. I had a question about what would fall under chronic illness, just for people because I have a feeling that some people would be listening to this and not necessarily even know that their symptoms would fall under a chronic illness.
Sure.
Is there can you shoot off a couple?
95% of the patients that come into my office have high blood pressure, have some type of thyroid disease, have some, history of cancer in their family, heart disease, in their family. So, these are the more chronic illnesses, gallbladder problems, renal problems, kidney problems. But those are, the typical things. And then we go into the mental health side of it with chronic illnesses, depression, anxiety. These are things that, more and more people are seeking out the help, of chiropractors and acupuncturists to, really calm down that overactivity of their nervous system. So these are the chronic illnesses that we're seeing. Diabetes, excuse me, I forgot diabetes. Diabetes is the biggest one,
Yeah.
And it's all related to what we're eating, really. So it all comes down to lifestyle. And unfortunately, medical physicians are just not trained in talking or educating people, or even knowing themselves, how to make these changes in your lifestyle to reduce the chances of chronic illness.
Yeah.
So just wait until you get it, and now we'll treat it. It doesn't make any sense to me at all.
Okay, so I think a lot of people are going to have questions about what does chiropractic care have to do with all of those diseases that diabetes and all that. So
Sure.
I think let's break down why or how chiropractic care and acupuncture actually impact those diseases.
Listen, I don't claim to treat any of these diseases. I, as a chiropractor, like I said earlier in the podcast, I am a piece of what I term, a healthy lifestyle, along with proper sleep, proper diet, exercise, sunlight exposure, and, proper supplementation when needed. So, there are multiple aspects of a healthy lifestyle. Chiropractors, we treat the engine of the body, the brain and the spinal cord. The brain and the spinal cord make up the central nervous system. The central nervous system controls every cell, every muscle, every tissue, and it has a direct impact on all of your vital organs. Your brain needs to tell what your vital organs to do. And if there is any type of interference of that signal from your brain to your spinal cord, to your spinal nerve roots, and then to those cells, then your body is not going to function optimally, and your body is not going to adapt to stress as easily. The body breaks down over time. And the beauty of chiropractic care is that it makes our body more adaptable to stress. Now, 95% of people, equate us to pain, headaches, numbness, tingling, car accidents. It's very effective for that. It's very effective for that. But you're just scratching the surface. So, in my office, we're focused on those things, because if we can't get rid of those things, people aren't really going to put two and two together in terms of, oh, well, man, I'm sleeping better now. My headaches are gone. I'm digesting food better. These types of things that I hear all the time from patients saying, man, I didn't expect that, but now I'm experiencing that. Acupuncture is the same way. It makes sure that the flow of energy is strong and it's powerful. We want to get back to a state of equilibrium and rest in the body. We can't always be on. And if we're always on, and if we're always on that kind of fight or flight mode, your body's going to break down.
Yeah. And I think it's such a good point, because, we were not designed to be as stimulated as we are right now. Like,
absolutely,
we have a device in front of us, like 90% of the day now, whether it's a TV, a computer, a phone, some kind of console, and we're just constantly getting information constantly. So the way that we used to take care of ourselves, it doesn't apply anymore. And I think you have to start to grab these tools, new tools, and add them to your tool bag.
We're inside all the time.
Yeah, 100%.
We're not outside, not in the sun.
Yeah.
Everyone's scared of the sun, and it's the most powerful vitamin out there. It's natural and it's free. Yes, you can't stand on Fort Lauderdale Beach at 3 p.m. and be like this. As you can see from all the light on me, I'm pretty fair skinned, but you still need to get that sunlight for that vitamin D absorption. It is really, it's vital to health. And I know I've said this word 100 times, vigor, so.
Yeah. No. I think it's worth repeating that word as many times as possible, because I feel like a lot of people are just sort of getting by, surviving, and they live with the pain, and it's just like, okay, that's just how it is. My foot hurts, my back hurts, and you go through it every day. And there are tools out there available for you if you do a little research and get in action. And I think so many people are missing the mark on things like chiropractic care and acupuncture and more Eastern medicine that's been around for far longer
Yeah,
than some of the stuff that we're doing here in
far
the
longer.
East.
That's why it's called modern medicine. But whatever.
Which,
Yeah,
not to knock it down all the time. There's
yeah,
times where
of
we need it.
course.
Um, so, okay, so we talked about sun care.
Mhm.
I think the biggest, I think there's the obvious ones, right? Like sleep, exercise.
Sure.
I think food is probably the most mysterious one, or the one that's the hardest to, at least personally for me, wrap my head around,
Yeah.
because even when you think you're eating something healthy, you're not. There's so much misinformation out there about what's good for you, what's not. And, you know, I don't know if you can wrap this up in some kind of a bow, but I would like to give the listeners some tips or tools, like as to how to manage their food, or try to at least improve what they're eating without overwhelming the hell out of them.
you know, let me preface by saying that, everyone's gut is different. Everyone absorbs food differently, and everyone responds to different foods differently. I'm going to start by saying that. First off, water. You got to have filtered water. You cannot be drinking tap water. That is the first thing that people need to change. We drink, reverse osmosis water in our household. I'll add a little lemon or lime in the morning to that to detoxify my system in the morning. I always start my day off with a little warm lemon water and a little collagen, and just get rid. If you're drinking water from the tap, that's the first thing that people should eliminate. And just by doing that, they'll probably feel 10 times better.
Okay, so don't drink tap water. Like, you could filter the water. Is it?
Yeah, listen, there's the filters out there today. Like, I'm not going to tell you that a
Okay.
Brita filter is good enough, because it's not.
Okay. Got it.
A reverse osmosis filtration system, hydrogen water, stuff like that. You're going to want to spend
Okay.
a little money on a filtered water system. And that's the first thing that people should do if they're like really, stressed out about what's going into their body. And the second thing is, in my opinion, is to limit processed foods and sugar. To really limit those two things. If you eliminate processed foods out of your diet, now, yes, if you eliminate processed foods, now we're talking about a time commitment issue. We're talking about, how do I cook? How do I prepare these foods? How do I do that? That is the biggest obstacle. So
Yeah.
getting a schedule, prepping the food. Yes, you're going to have to put some time into it. There's no getting around it. Do you value your health? Because your health is your greatest asset. And what goes into your body is the most important thing that you're doing on a daily basis, 3-6 times a day, however many times you're eating. So in my opinion, that time is well spent. Some people would disagree with me, but those are the things. Processed food, eating whole foods, and eliminating sugar. Eliminating sugar is a lofty goal for a lot of people, and I understand that. Fruit is my substitute for anything, chocolatey or cakes or any of that stuff. But fruit, you also kind of have to keep an eye on. You can't just indulge in fruit as well. So getting rid of the
So,
processed foods is really important.
so I know you're not a nutritionist. So I'm putting you a little bit on the spot here, but I do have a question about this. So, is it like any so a lot of what I'm seeing too is replacements for sugar. So because like I have a sweet tooth, that's where I get in
Sure.
trouble. Like I love me cookies, I love me some cake and all that.
Yeah.
But for example, I have a friend who bakes and he doesn't use sugar and he doesn't use he uses almond flour instead, and he uses dates to sweeten the thing, and
Yeah.
like he really goes out of his way to make sure that this is that stuff
Yeah.
okay?
Yeah,
Is
of
it like,
course. You just can't
yeah,
use artificial sweeteners, dates, monk
okay,
fruit, that stuff. But even, I don't use any of that stuff. I mean,
yeah,
personally, dates I love. Dates you can use to sweeten up a lot of things. Dates are, something that I personally love. I don't eat too much of them, just because if I start eating those things, it's and if you consume too much dates, it's sugar. So that negatively impacts me. So
yeah, yeah,
I keep it, me personally, I'm on more of what would be termed an animal-based diet.
mm-hmm,
And my body just responds better to red meat. And that can be surprising to a lot of people, but I eat very high quality red meat. I mean, I'm grass-fed, grass-finished, ground beef is like 95% of my diet because that's how my body works. That's the best that I feel. And the better you feel, most likely what's going on underneath is functioning appropriately.
yeah.
That's me
And I
personally.
think for anyone listening, if you because I do think the idea of cutting out all processed food and all sugars can be daunting, overwhelming, unrealistic, fill
Sure.
in the blank, like whatever, right? But I think the question also is, okay, well, maybe you can't cut it all out, but what can you cut out? Like, can you take it to, if you're doing it every day, can you take it to 3 days a week?
Sure.
Can you take it to two? What can you do? Because I'm in my coaching, I really try to meet people where they're at. And I really try to go, okay, how can you train yourself to do this? Because we have this expectation that we should just be able to be masterful and like I'm going to be super healthy starting tomorrow.
Yeah.
Probably not, right? Probably it's going to be a process that you work on, that you develop a daily practice. Um, and even for example, like I'll still have my cookies, but I do go get my acupuncture and my chiropractic care every, I do exercises a few times a week. Like there are some things that I can do as staples to
Yeah.
anchor me and give me some skin in the game, at least so that I can at least, have something happening. So anyway, I just wanted to say that
Balance.
because I feel
Yeah. Balance, man. I mean, you know, when you say the word balance, I mean, me personally, there is some balance. Me and my fiance and I, we will go out occasionally and we'll go to a restaurant, we'll eat. We'll both be very aware of what we're eating at the restaurant, because you have no idea what's in the food in restaurants. You just
no, and
don't
that
know.
yeah,
You just don't know. So, a lot of restaurants cook in seed oils, and me personally, I don't consume any seed oils. I've seen enough research to know that these oils are detrimental to our health and specifically our cardiovascular system. So, balance is a good term, but you should balance is a tricky term. All right. If someone's like, oh, well, then I can cheat 2 times a week. And, well, yeah, but that's 2 meals, not 2 whole days, because now you're talking about 6 meals. And that's not okay. That will negatively impact your health over time. So,
mm-hmm.
listen, man, there are so many ways. Whole food. I mean, me personally, I think my food tastes better than most restaurants out there. Me personally, that's just me. I like the way I cook. I like the food that I prepare. Some people like you're crazy. But most people don't have the basic idea of how to do that at home. So, balance is good for your mental health. Balance is good. But you got to be careful with that too.
Yeah. Can we get into how
Get into anything you want, Gary.
some of this food, it helps, it ages you, and some of it helps you not age.
Yeah.
Can we talk a little bit about that and give us
Sure.
your
There,
wisdom?
there's a big difference between your chronological age and your biological age. Your chronological age is, the number associated with your age. Your biological age is how much we use up our organ reserve, how much we're using, our organs, and how well they're functioning, and how much we have left of our organs as we age. So our biological age is mainly determined by the lifestyle choices that each individual makes. And I am more and more passionate about that with everyone that comes into my office, because I know that if my patients are going out and just loading themselves up with toxic food, toxic environmental stresses, they're not going to respond to my care. All right. We're conservative healthcare providers. So it is there is accountability on the patient. The patient needs to be accountable, because we're only seeing them for like 10, 15, 20, 30 minutes. And the rest of that time, they're on their own. So food is absolutely, directly correlated with our biological age and how much we are depleting our organ reserves over time. And the more you deplete your organ reserves over time, your biological age is going to increase. We all know people that look much older than what they are. And we also know people that look a lot younger than they are. I mean, I'm 46 years old. I don't think I look 46 years old. And I believe I don't believe. I know that that's the result of the last 25 years of my life, being very conscious about, how I live on a daily basis, including what I'm putting into my mouth. So did that answer your question? Did I get away from it?
Are there so it's the foods that age us in general would be just the toxic stuff, like the sugar. Yeah.
Sugar. Every chronic illness feeds on sugar. Any change or damage to our DNA at the most cellular level is the result, mainly, in my opinion, of sugar. Sugar is like a breeding ground for chronic illness, specifically cancer and diabetes. So yeah, man, unfortunately, it is the most addictive substance on the face of the planet.
So addictive.
It's more addictive than cocaine. It's more addictive than cigarette smoking. It's more addictive than heroin by like 1,000 times. It is extraordinarily addictive. Even in the form of fruit, even in the form of fructose, it's addictive. So that's my opinion. My opinion is that if people really limited their sugar consumption in all forms, berries and stuff like that, that's all good. You're not going to die from eating an orange or an apple. I'm not saying that,
No.
That's not what I'm saying. I think the listeners will understand what I'm saying.
Yeah.
You just really need to limit the sugar intake. And some people are either, you'll hear the people say, well, you got to live. I understand that. And I substitute sugar for other things that make me, that satisfy me, that satiate me and get rid of that craving. So, that's my opinion on that.
I've had experiences where I have detoxed from sugar.
Oh, yeah.
I will stop eating sugar, and my body literally goes through detox. Like, I have headaches. I feel awful. I am
can't sleep.
I mean, it's like 3 days of hell
Yeah.
until you really, and all it takes is one
Yep.
taste of it.
And then it's
And
done.
then you got to do the whole thing again.
It's done. And it's funny you say that, because over the holidays, my staff knows, like, they barely see me eating. They rarely see me like eating anything that's not healthy. And over the holidays, we have tons of patients that bring us all these treats and snacks and homemade cookies and all this stuff. So one day
indulged.
I was like, you know what, I'm doing this. And my staff was like, who are you? What have you done with Dr. Friedman? And, one piece of that crumble cookie. And I'm like, okay, it's over. And, I had homemade cookies from patients that were amazing. So one day, I ate probably 9 pieces of, candy or cookies at the end of a shift. And of course that night, my fiance has to, hear me like, oh my God, I done it, and you wake up the next day and it's like I'm hungover. I'm like food hungover. And that never happens to me when I'm eating the foods that I typically eat. So I don't understand how people do that day in and day out. I don't get that.
Well, I'll tell you how. It's because you operating sluggish becomes your normal.
Yeah.
And operating with the chronic pain, as we talked about before, it becomes your normal. And you just get used to it, and you think that is what life is like, or this is normal, or whatever, which is why that word vitality that you keep using is what's it? Vigor. Thank you.
Yeah.
Vigor. It hits when you say it, because I do think that most people are not living that way when it comes to their body, their wellness, their care.
It's a shame. It's a shame, really, because our life expectancy has obviously, grown over a period of time just with basic, sanitation practices. But we're not, the longer that we're living, we're all living with chronic pain, chronic illness, chronic disease, and everyone is just going to doctors when they're supposed to be, enjoying the fruits of their labor. We're working for 60, 65 years, or if you're lucky, or if you're, before that. But then you have about hopefully 15 to 20 years to retire and enjoy. But you're busy most people are busy going to doctors because their bodies are so broken down at that point. So what's the point? So, it just, listen, as a chiropractor, we make the dentist example all the time. We make that parallel all the time. People take care of their teeth because they see it. They see their teeth. Your teeth start to decay. You notice it, and you want to take action because, people don't like looking at people with gritty, grimy teeth. Your spine does the same exact thing over time. It decays. It gets jagged. There's arthritis that forms, and people don't see it until they come to a chiropractor. They're in pain, in chronic pain, and then they're like, oh, this just happened 2 weeks ago. And then I take an x-ray of them, and they're just wrecked in their x-ray. Well, Mr. Jones, this didn't happen 2 weeks ago. That just is where you plunged off the cliff, and now you're here in my office. So.
I work with a lot of entrepreneurs, and when they come to me in distress, when they come to me, oh, business isn't working, I don't know, like everything's a mess, I'm losing. One of the first things I inspect is their self-care.
Yeah.
Like, how are you taking care of yourself? Are you stepping outside? Are you and it is without fail always one of the symptoms of their business not working out. Because when and entrepreneurs are notorious with this, they part of it is that it's your business, you love what you're doing, it's fulfilling and all of that stuff, so it's easy to just keep grinding and not stop to go, wait a minute, am I eating right? Am I yes, it's my baby, but if I keep eating Doritos for lunch every day,
Right.
You know, if I keep putting 16-hour days every day and not stepping outside and going for a walk, if I, you know,
Yeah.
it always backfires and takes them out of the game, because now they have to actually go put themselves together for a week or two so they can even start working again, because they're so messed up.
Yeah.
You know, from their mental health, from the thing. So
The rat race.
it's really important, and not just for I think what I'm trying to say is that it really shows up in all areas of your life.
Mm-hmm.
You know, when your health is not right, you're not right at home, you're not right at your business, you're not right at your job. Like, you're just not getting the best out of you for life.
Mm-hmm.
So this stuff is really, really important. And I hope that we have inspired somebody to, you know, put the cookie down. I don't know. I'm gonna go put the cookie down.
You know, it's what do you want to out? You know, it's a little bit of
Yeah.
discipline. It's a little bit of, listen, it just makes me feel like, to be honest with you,
Yeah.
if I eat those things, it makes me feel like, and it's just not worth it to me anymore. Yes, I will indulge from time to time, but I know, and my fiance knows, that I'm
Yeah.
bitching and moaning because my stomach is a blah, you know?
Yeah.
And
And if you stop and you take it out, you will have that experience that Dr. Adam is talking about.
yeah,
Because most people, I'm sure the normal person's like, I don't get like that when I have a cookie. I'm like, you do. You're just so numb to it that you
right,
can't tell. But if you actually take it out and clean your system, you will feel that
right.
that hit that he's talking about.
Yeah, I mean, some people don't respond negatively like that, of course, you know, but overall, it's leading to something down the line. You know, you're just
Yeah.
more susceptible to stuff.
Yeah.
So,
I'm personally getting recommitted.
well, good, good, man.
I'm getting recommitted to the sugar. That honestly, that's my jam. I mean, I'm pretty good with my self-care. It's the sugar aspect and the food aspect that I struggle with.
Yeah. Listen, man, you don't be so hard on yourself. I mean, you've been getting chiropractic care for 3 years, and you know, obviously, I'm slightly biased with that, but your brain and your spinal cord, you know, they're the engine of your body. Everybody should be seeking out chiropractic care. I don't care if you're in pain. I don't care if you're 5 years old. I don't care if you're 95 years old. Find a good chiropractor. Find a good mechanic for your body, because we're all exposed to environmental, chemical, and physical stresses until the day that we are laying horizontally permanently. That stuff never ends. And chiropractic care is a beautiful thing when it comes to undoing those stresses on the body, because I don't want to see you when you fall off that cliff, because I'm only going to be able to get you back to a certain point. So listen to the little things. Listen, you viewers should listen to the, oh, I can't move my neck as much, or I can't bend forward as much. That is a warning sign. It's a warning sign that you need to get checked, and that you should start being more, think about your health and well-being in a more proactive manner, as opposed to this allopathic model that we have that is good for traumatic injury or acute illness. It's not good for keeping people healthy and well and living life to the fullest. And that's what we do as chiropractors. So
I love it. Something I did want to ask you before you go, because I forgot about this. I read something like sitting is the new smoking.
Mm-hmm.
You know, like, and I do, like, there's, you know, first of all, like,
yeah,
right. So you're always like, you always have your neck like this now, right? And we spend so much time sitting down. So I guess like, talk to me about that and how that's playing a role, because
you talked about two important things there. Looking down at our cell phone we're going to have a rash of neurological diseases stemming from that. You know, you have very sensitive neurological structures in the neck that go up into your brain. And when everyone is, you know, down like this, I mean, I am seeing a younger and younger cohort of patients teenagers and they're coming in and their necks are wrecked and they all have headaches, they have numbness, they have tingling. And when I x-ray their neck, it looks like I'm x-raying a 55-year-old. And it's really not good. So if I could tell everyone that's listening two very important things, okay? Look down with your eyes. Look down with your eyes. We have two eyes. Use them. Do not look down with your head. If you bring your cell phone up like this, it looks like I'm recording you. It looks like I'm a creep. Yes. All right. So try to look down at your cell phone with your eyes and not your head. Sitting, absolutely. I don't care if you buy $1,000 chair or if you have a $20 chair. Sitting is smoking for your spine. It is a compressive force on the spine, and it's not good. So sit, stand desks are ideal. All right. For people that, more and more people are working from home these days. So sit, stand desks are important, and
Mine have a little hydraulic situation happening.
Try to be eye level with things. Don't be looking down all the time. If you're looking down all the time, it is not only going to cause neck pain and headaches, and it's going to crash your energy. It's actually going to have a negative impact on your blood pressure, believe it or not, and a variety of other things. So, sit, stand. If you're working from home, take a break every 30 minutes. Walk around the house, take a lap, go outside real quick. Obviously, we're in South Florida, so it's a little easier for us to do that. But don't sitting for more than 30 minutes at a time. You're doing your spine an injustice, basically.
You heard it here first.
Thank
you, Dr. Adam. Love to have you back on the show. You were a great guest. It's a pleasure.
Thank you so much for having me, Gary. And, thanks for being such a great patient. We really appreciate you at the office. And hopefully this inspires, other people to start taking control of their own health and well-being, because your health and wellness is truly your responsibility, and it's up to you. So I appreciate it. Thank you.
It is. I think for many of us, today's topic can be overwhelming. Not only is it a lot of information that can be dense and confusing if you don't have a medical degree, it's often information that contradicts what we've previously been taught. We also have to acknowledge that it requires a great deal of effort, time, and money to do things like avoid processed foods, get a standing desk, or invest in weekly chiropractic care like I do. It's a privilege that many simply don't have, especially in marginalized communities. But with that being said, if you're willing to get in ownership, there are some simple and free daily practices that you can start to implement that will start to make a significant impact on your overall health and wellness. Going for a walk, taking in some sunlight, standing up and stretching every 30 minutes, taking the stairs, opting for a piece of fruit over the cookie when it's available. These are all simple and not very time-consuming things that you can introduce into your daily routines. Just start by adding one practice, and little by little, as you get the hang of it, add another and then another. Many of us come from life experiences where paying attention to this was frivolous or just a luxury that you could not afford. But the question I want to leave you with is, how much is it costing you not to pay attention to this stuff? And what's the compounding interest on that debt? As always, thank you for joining me today. I'll see you next week.
Thanks for listening to this episode of The Ownership Game with your host, Gary Montalvo. Make sure to like and comment on your favorite podcast platform, as well as subscribe so that you never miss an episode.